Health outcomes in general are impacted by a lot of different areas. There's something known as the social determinants of health. And what this is it's all the different aspects that affect our health outcomes. So why does one person die younger than another person? And if you look at different populations, even in different areas of the United States, you can see they have very different health outcomes. It's even different between races and genders. There's a lot of different reasons that this exists, but a lot of times it has to do with financial security, access to healthcare, pollution, both water and air pollution, access to healthy food, time to make healthy food, safety. If you're living in a community where you're constantly worried that you're unsafe, that stress is going to affect your health. The World Health Organization put out a really amazing article years ago saying that the number one cause of poor health is actually poverty. You can't focus on health and wellness without looking at poverty and addressing poverty, because poverty is one of the highest correlators to poor health outcomes. So if you are poor, even if you eat healthy, even if you exercise, not having access to that healthcare, having the stress of being poor is going to lead to worse outcomes. Currently, our federal government is looking at defunding things like WIC, Medicaid, and SNAP. These help people that are in these high-risk categories get food and healthcare to help keep them healthy. And if we keep them healthy, it prevents the need for additional costs in the future. So healthy people are more likely to work. They're less likely to be on disability. They're less likely to need insurance through disability. When they're working, they generate revenue for the government through taxes. So paying to help a child grow up and be healthy actually benefits us and our economy. It's not a selfless act. It makes our entire country stronger. And for some reason, we've lost that in America, and we don't understand that we cannot just do everything as an individual. You as an individual cannot control air pollution. Air pollution is because of everything else around you. We share the air. Therefore, we need to share the responsibility of having clean air. And we can't keep saying, well, it's not my responsibility, or I'm doing what I'm supposed to. Then we go to the wellness culture, which wellness culture extra feeds into this, because wellness culture is all about you and your personal responsibility. And if you're having health issues, it's because you're not doing something you should be doing. When I got my autoimmune disease, I saw some integrative practitioners, and it was very much communicated to me that my issue was related to mental health and diet. And if I fix those two things, my autoimmune disease will go away. And while I've worked on those things for a very long time and they have benefited me, they did not cure my autoimmune disease. And this idea that you can control your risk of an autoimmune disease or getting a degenerative disease or even cancer, yes, you can reduce the risk, but your risk will never be zero. And we need to accept that. And the best we can do is actually help our entire population be healthier instead of just focusing on ourselves. So I want you to just take a moment to think about that and think about why we can't just focus on individuals when it comes to healthcare. We need to focus on systems and the big picture.